Welcome to Ulosca channel. Access all nursing practice questions. HESI 225 RN Pharmacology practice questions with answers.
Question 1. A client taking furosemide reports muscle cramps. Which lab value should the nurse check first? A. Sodium. B. Potassium. C. Creatinine. D. Hemoglobin. Which one is the correct answer? The correct answer is B. Potassium. Explanation. Furosemide is a loop diuretic that causes loss of potassium through urine. Hypokalemia can lead to muscle cramps, weakness, and cardiac arrhythmias. Monitoring potassium levels is critical to prevent serious complications. Question 2. A nurse is administering digoxin. Which assessment is most important prior to administration? A. Blood pressure. B. Temperature. C. Apical pulse. D. Respiratory rate. Which one is the correct answer? The correct answer is C. Apical pulse. Explanation. Digoxin slows conduction through the AV node and can cause bradycardia. Therefore, checking the apical pulse for 1 full minute is essential before administration. If the heart rate is below 60 bpm, the medication should be held and the provider notified. Question 3. A client with chronic pain is prescribed morphine for. Which adverse effect should the nurse monitor for? A. Respiratory depression. B. Hypertension. C. Tachycardia. D. Urinary frequency. Which one is the correct answer? The correct answer is A. Respiratory depression. Explanation. Morphine is a potent opioid analgesic that depresses the central nervous system. One of its most serious adverse effects is respiratory depression, especially when administered intravenously. Continuous respiratory monitoring is essential to ensure patient safety. Question 4. Which instruction is most important to give a client starting warfarin therapy? A. Avoid dairy products. B. Monitor for signs of hypoglycemia. C. Report dizziness or blurred vision. D. Avoid sudden increase in vitamin K intake. Which one is the correct answer? The correct answer is D. Avoid sudden increase in vitamin K intake. Explanation. Warfarin's anticoagulant effect is reduced by vitamin K. Sudden increases in dietary vitamin K can decrease the drug's effectiveness, increasing the risk of clot formation. Patients should maintain a consistent intake and avoid extremes. Question 5. What is the antidote for acetaminophen overdose? A. Flumazenol. B. Acetylcysteine. C. Naloxone. D. Protamine sulfate. Which one is the correct answer? The correct answer is B. Acetylcysteine. Explanation. Acetylcysteine is the antidote for acetaminophen overdose. It works by replenishing glutathione, which neutralizes the toxic metabolite that accumulates in the liver during overdose. Early administration is critical to prevent liver damage. Question 6. A client taking lisinopril reports a persistent dry cough. What is the most appropriate action? A. Encourage fluids. B. Notify the provider to consider changing the medication. C. Recommend a cough suppressant. D. Instruct the client to stop the medication. Which one is the correct answer? The correct answer is B. Notify the provider to consider changing the medication. Explanation. Lisinopril is an ACE inhibitor, and a dry, persistent cough is a well-known side effect caused by the accumulation of bradykinin. The provider should be notified so the medication can be changed, often to an angiotensin receptor blocker, which does not cause cough. Question 7. Which of the following medications requires peak and trough level monitoring? A. Metoprolol. B. Heparin. C. Vancomycin. D. Acetaminophen. Which one is the correct answer? The correct answer is C. Vancomycin. Explanation. Vancomycin is a powerful antibiotic that can be nephrotoxic and ototoxic if not dosed correctly. Peak and trough levels are monitored to ensure therapeutic efficacy while avoiding toxicity. Trough levels ensure the drug is adequately cleared, and peak levels ensure effectiveness. Question 8. A client is prescribed nitroglycerin sublingual tablets for chest pain. Which instruction should the nurse give? A. Swallow the tablet with water. B. Place the tablet under the tongue and let it dissolve. C. Take 1 tablet every 10 minutes for pain. D. Store tablets in a warm, dry place. Which one is the correct answer? The correct answer is B. Place the tablet under the tongue and let it dissolve. Explanation. Nitroglycerin sublingual tablets are absorbed directly into the bloodstream through the oral mucosa for rapid onset. They must not be swallowed. The nurse should instruct the client to let the tablet fully dissolve under the tongue for quick relief of angina. Question 9. Which lab test is used to monitor the therapeutic effect of heparin? A. INR. B. PT. C. APTT. D. Platelets. Which one is the correct answer? The correct answer is C. APTT. Explanation. Heparin affects the intrinsic coagulation pathway, and its therapeutic effect is monitored using the activated partial thromboplastin time. Adjusting the dosage based on APTT helps maintain a balance between preventing clots and avoiding bleeding complications. Question 10. A client is receiving gentamicin for. What adverse effect should the nurse monitor for? A. Hypoglycemia. B. Ototoxicity. C. Hyperkalemia. D. Seizures. Which one is the correct answer? The correct answer is B. Ototoxicity. Explanation. Gentamicin is an aminoglycoside antibiotic known for its potential to cause ototoxicity, which may be irreversible. The nurse should monitor for hearing loss, tinnitus, and balance problems. Monitoring drug levels can help prevent this toxic effect.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.